One thing about the side posture, make sure that you see this kind of angulation on the shoulder. This shoulder, the lower shoulder, has to be down so that we can traction this upper shoulder up. So keep that in mind. For the ilium contacts, for the pushes, you just always put the contact side up for the push adjustments. I'm going to bring the knee up. Remember, I'm going to hold the ankle off of this other leg so that I can slide it. I'm going to bring the knee up for a PI just enough until the joint starts to wiggle. That's it right there. It's already moving. If I keep bringing that knee up, I'm pushing the ilium further into the PI direction. I want it right against the subluxation. So for a PI, soft pisiform, you get on the inferior medial PSIS right there. Sorry, the inferior PSIS. Fingers up the spine. Roll the patient to you. You notice I'm not touching them with my thigh yet. Roll them up. Shift your weight up over the contact. My weight's entirely on the front leg. I'm going to unload my front knee. Just let it bend a little and drop into the contact. That's a PI. PIIN would need some medial to lateral. So we're going to get on the inferior medial PSIS and turn the fingers out a little bit. There's a PIIN. Push. IN, which you can do this way, it's not my preferred way to do it, but you can turn the fingers straight out and go medial to lateral like that. Remember, INs and EXs need some torque. Their torque is backwards. So that would have been, the IN would be medial to lateral, clockwise torque. So the adjustment would look a bit like that. PIIN, it's P to A, I to S, medial to lateral, clockwise torque on the left. PI, up the spine, no torque, P to A, I to S. If it's an EX, ilium is external, I should say the PSIS is external. We're going to contact the inferior lateral PSIS and point the fingers diagonally across the spine. That gives me P to A, I to S, lateral to medial. And then as we set, we'll produce on the left, it follows the torque rule, counterclockwise torque, like that. With straight lateral, work along the joint plane, that's an EX, lateral to medial, counterclockwise torque on the left. One mnemonic that you can use for hand positions on this ilium is if it's pointed back toward you, that's an IN, I-N, pin, P-I-I-N, pi, P-I, hex is P-I-E-X, and X, that's the EX. So you remember in, pin, pi, hex, X, 45 degrees. In, pin, pi, hex, X. Now for the AS listings, all the ASs, the contact, you move from the PSIS, 2 inches lateral, 3 human inches inferior. A human inch means an inch that's appropriate size for the size of your patient. A short person would have a smaller inch, right? So 2 over, 3 down, that puts me on the posterior acetabulum. So the point we're going for, 2 inches lateral, 3 inches inferior, right here, posterior acetabulum, near the ischial spine, right there. We'll be contacting going P to A, S to I to correct that. So 2 over, 3 down. If you go mainly up the spine, now notice this arm is aiming S to I, right? That's an AS. If I turn it this way, that's an ASIN, like that. ASEX is like the PIEX, but it's down here at the Gonstead fossa, Gonstead eminence. The hand is this way. The drive still has to go like that, so the adjustment's kind of more of a karate chop. That way. It's a little harder to do. Pulls are easy.